1 year ago today, South Korea confirmed its first COVID-19 patient. And since then, the number has swelled to over 73,000, and more than 1,200 people have died from the novel coronavirus here in this country. The country's handling of the pandemic has sparked global interest as the country was initially able to flatten the curve rather early last year, then dealt with two more major waves of the virus. Today, we look back on the past year of living with the virus in South Korea and try to unpick some of the lessons learned and some of the challenges ahead in 2021. And for this, I'm joined by Thomas Maresca, Asia correspondent for United Press International, based here in Seoul. Welcome to the programme. It's lovely to see you this morning.
Thank you.
We also connect with Michael Baker, Professor of Public Health at the University of Otago in Wellington. Thank you so much for joining us this morning.
Greetings, it's great to be on your programme.
Well, let's go straight into the discussion, starting with you, Mr. Maresca. Now, South Korea saw its first confirmed case of COVID-19 last year on January 20th. And since then, of course, there's been a lot of global attention on Korea's response. And what do you think was perhaps the most important aspect of Korea's response to COVID-19, as it did initially flatten the curve and conducted tests and contact tracing rather effectively?
Yes, well, I think, as you said, testing and tracing was the method used to flatten the curve. But even before then, South Korea had a plan and a playbook in place, and they followed it really quickly. They got off the mark extremely quickly in terms of arranging for tests to be produced. They reached out to the private sector and said, we'll streamline the approval process. And pretty much there was a working test within a couple of weeks, I think, after the first case, a confirmed case. And they also had a legal framework in place to allow for this centralized contact tracing system to be legally operated, by the Ministry of Health. They were able to access credit card usage, mobile phone GPS data, and that was put in place after the 2015 MERS outbreak here. So they learned from a previous outbreak, and they were quick to implement this playbook. And I think the last thing also kind of learned from the MERS outbreak was that they really stressed transparency and communication, and that helped facilitate the public buy-in to the processes, which I think was vital as well to containing the outbreak.
Okay, so lots of regulatory agility that we saw there, built by past administrations, I suppose, learning from the MERS outbreak. And Dr. Baker, what did you think was perhaps the most important aspect of Korea's response to COVID-19 over the past year?
Well, I think that the points that we just mentioned, in New Zealand, we look very closely at Korea's approach to managing the pandemic, and we were very impressed with your systems for testing, contact tracing. I think it was a real world leader, and so we adopted a lot of those similar approaches here.
And well, Mr. Maresca, now I want to hear what it's been like for you as a correspondent here, living and reporting in Korea for the past year amid the COVID-19 pandemic. I mean, is there a certain story that you covered that was particularly memorable for you?
Well, I feel, I've always felt fortunate that I've been here during the course of this pandemic. I'm from New York City originally, and I have a lot of friends and relatives there, and their experience of, being under the lockdowns and the amount of, disease and death there has been such a contrast to here. From a professional standpoint, it's been a place that there's been numerous stories that have emerged from here. South Korea has been in the international spotlight. The stories that stand out for me are ones that you get to see a little bit behind the curtain. I visited a couple of hospitals in Daegu after the outbreak and was able to go behind the scenes and spend time with the nurses there, and got a sense of just how hard they worked and how much they sacrificed to control that initial outbreak. A more recent story I did that was interesting to me was I followed a delivery driver around, and they've been kind of bearing the brunt indirectly of the virus in terms of keeping society running, but they've been working incredible hours. Many have died from overwork this year. So sort of seeing behind the curtain of how the pandemic has affected different segments of the society has been interesting for me.
Right, we really can't forget how hard those medical workers in Tegel were working with those hazmat suits that just add kilos to their already heavy equipment, and just the bandages across their faces. It's
absolutely.
Well, hopefully, this wide-scale vaccination will make things easier for them. But well, in the meantime, Dr. Baker, now New Zealand, it went into lockdown very early on. It was a very hardcore lockdown, and the borders were also shut as well during the early days of the pandemic. But recently, your government has said that it's going to start reopening the borders. Is there any concern about this? And also, how are you planning to sort of manage the border control as well as you slowly start opening up?
Well, the thing that New Zealand did was adopt an elimination strategy early on, and we concluded that actually it wasn't going to work to try and live with the virus. And I think the evidence over the last year has really confirmed that trying to exist with the virus it doesn't work well for countries. And we've just published a big review of this in the British Medical Journal, which looked at really the first year of data, and it showed that the Asian model, and also with the Pacific as well, with Australia and New Zealand, is working very well, that it's protecting public health and also protecting economies, and they're performing much better than much of Europe and North America, where they're trying to live with the virus and suppress it or mitigate it. So moving to the present day, New Zealand is continuing with this approach, and in terms of opening the border, it's still very much around maintaining that elimination status. And we think about a risk-based approach, or using a traffic light system where we can open the borders to other countries that have eliminated the virus. If you like, they're the green zone. We've just started doing that with Pacific Islands. We hope to do that shortly with Australia as well, where you can have quarantine-free travel. But at the same time, we also recognise there's a red zone, which is unfortunately much of the world, where there's uncontrolled pandemic spread, and also the emergence of these more infectious variants. So we want to work very hard to minimise the risk of importing those cases. And so, of course, people from those countries will still go through 14 days quarantine in New Zealand and have a number of tests. And in addition, they are going to have pre-departure tests in their source countries. So we haven't in any way changed our approach. We're just getting, I think, a bit more cautious about how to manage the borders as we go ahead.
And it's been nearly a year since the global pandemic was declared, Dr. Baker, but in most parts of the world, the debate is still ongoing on whether we should prioritise a lockdown or the economy. Which approach do you think is right?
Well, actually, I think it's a false dichotomy. The evidence is that protecting public health with a short, sharp lockdown, which eliminates the virus, also protects the economy. And although New Zealand had a very intense lockdown early on, when we had just 100 cases, the virus was in the community, and by doing that we eliminated it. And since then we've actually had a lower level of lockdown than virtually every other country on earth during this subsequent period, because we have no virus. So I think the combination of a lockdown to get rid of the virus, managing your borders, and also using other measures, masks, and again, learning from Korea that the testing and contact tracing, all of those capabilities, using all those methods means that life in New Zealand has returned to pretty much normal. And also our economy is recovering very swiftly, like it's a V-shaped recovery, compared with countries that didn't pursue a vigorous lockdown at the beginning, have actually unfortunately had to sustain a mid-level lockdown for the subsequent period. So I think lockdown is a tool to use at the beginning, not at the end. That's our experience.
Well, I think that's very important to remember. Lockdowns are effective in the beginning, not the end. And well, Mr. Maresca, nowadays, what do your readers, what do the global audience really want to read about or hear about regarding South Korea's example responding to the COVID-19 pandemic?
Well, I think, from the start, South Korea has been in the spotlight. It was the second country after China to really have a large-scale outbreak. So there's always been a lot of attention on South Korea's response. And initially, it was just to observe and follow how South Korea was able to control the outbreak. There was interest in the innovations, things like the drive-through testing. Over the months, I think, as the pandemic raged in other parts of the world, people looked to South Korea to see a sort of return to some semblance of normalcy for a while. We had a general election in April, the professional baseball season started. So those were kind of interesting points for the rest of the world. I mean, over the last couple of months, I think now people have been wondering what has happened in South Korea. We're in the midst of a third wave outbreak, although we do seem to be past the peak of that. But I think that has raised questions and interest in terms of how did South Korea, which had been doing so well, experience its largest outbreak of the pandemic in these recent months, and will the country and will the health officials be able to get it under control?
Right, so 3 major waves we had, and it's been quite interesting to see how quickly the public health authorities are responding to this. So hopefully we will see the third wave really being quelled in the weeks to come. But Dr. Baker, now we're talking about wide-scale vaccinations these days, and countries like South Korea, Australia and New Zealand, they haven't been in that much of a hurry compared to countries like the UK or the US and countries in Europe, of course. And while some say that there's no need to rush into this and it's better to wait and see, others argue that we really should get that virus rolled out across the public. What's your perspective on this? Which argument would you really stand for?
Well, I think it's a mixture of both. I mean, the New Zealand approach is to import moderate quantities of vaccine, which will be arriving in the next month, and use it in a very strategic way to vaccinate border workers, particularly in frontline healthcare workers, as part of our continuing approach to excluding the virus from New Zealand. And we're happy, or I think we accept that we'll wait much longer to vaccinate the whole population in the second half of the year. And it's partly because countries where the pandemic is very intense have a much greater need for vaccine now, which is still in limited supply. And it's really a matter of life or death for many countries at the moment to have access to vaccine. So I think the feeling in New Zealand is we can wait, we can be further down in the queue because of that. But we will be getting small amounts, as I say, to use very strategically in the next month or so.
And Mr. Maresca, now infection cases, as we said, have been spiking lately, and there have been 3 waves of the virus in South Korea. And there's been some criticism about the delay of procuring the vaccines for South Koreans. What are going to be some concerns or challenges that Korean society will have to work through in the coming weeks and months?
Well, yeah, I think, as fast as South Korea was to react to the pandemic at the outbreak, they've been slower. The government has been slower in terms of responding and procuring the vaccine. I think the attitude was more similar to what Dr. Baker just said about New Zealand, kind of a wait and see approach. But the rise in cases has accelerated the demand for the vaccine. And so the health officials seem to be scrambling a bit. They've procured enough orders to cover the population, but I think there's going to be a lot of questions. We really haven't seen a plan as to the distribution, really answering the details of how it's going to get out to the public. Are there enough public health centers? Are there enough trained personnel? We don't really know the delivery schedule yet. So, we've seen the difficulties in rollouts in other countries. So, it's not a given that South Korea will handle this as effectively. The president and other health officials have pointed to November as a time to achieve herd immunity, but that certainly remains to be seen. And, in the meantime, I think, we'll see. We've seen how easily another outbreak can occur. So we're going to still be grappling with just trying to maintain control over this virus.
Right, and of course, public health officials have emphasised the importance of prudence in designing all of this, really engineering the distribution and all. But of course, as you said, time is of the essence. So hopefully we will see South Korea being quicker to really roll out those vaccinations. Well, I'm afraid this is where we're going to have to end the discussion today, but that was Thomas Maresca, Asia correspondent for United Press International, and Michael Baker, Professor of Public Health at the University of Otago in Wellington. Thank you both so much for your time.
Thank you.
Thank you very much.
And to our viewers, as always, thank you for watching.